The Senate will come to order. Mr. Majority Leader.
Thank you, Mr. President. I move a call to the Senate.
Call has been moved and properly sustained. Will the sergeants please close the doors, allow no senators to leave, retrieve all those who are absent back to the chambers. Mr. Panetta, please call the roll.
Bridges. Bridges.
Buckner. Coleman. Cook. Quorum. Danielson. Donovan. Benberg. Fields. Gardner. Janal. Gonzalez. Hanson. Heisey. Holbert. Hawkes Lewis. Kirkmeyer. Lee. Liston. Lundeen. Moreno. Pedersen. Priola. Rankin. Rodriguez. Scott. Simpson. Smallwood. Story. Winter. Woodward. Zenzinger. All right. Cook. Quorum. Danielson. Donovan. Fields. Gardner. Lee. Still not here. Priola.
I'm really excited the chairs are back, but I've been so used to having your workspace as my workspace.
Scott. Zenzinger.
Scott.
Will the clerk please add Senator Kolker to the roll call? Mr. Majority Leader.
Thank you, Mr. President. I move the call be raised.
You have heard the motion. All those in favor say aye. All those opposed, no. The ayes have it, and the motion is adopted, and the call is raised.
Holker's present.
Committee reports.
May 25th, Committee on Finance. After consideration on the merits, committee recommends the following: House Bill 1282 be amended as follows. So amended, be referred to Committee on Appropriations with favorable recommendation. May 25th, Committee on Finance. After consideration on the merits, the committee recommends the following: House Bill 1189 be referred favorably to Committee on Appropriations. May 25th, Committee on Finance. After consideration on the merits, the committee recommends the following: House Bill 1254 be referred favorably to Committee on Appropriations. May 25th, Committee on Finance. After consideration on the merits, the committee recommends the following: House Bill 1233 be referred favorably to Committee on Appropriations. May 25th, Committee on Finance. After consideration of the merits, the committee recommends the following: House Bill 1105 be amended as follows. So amended, be referred to the Committee on Appropriations with favorable recommendation.
Second reading of bills. Senator Moreno.
Thank you, Mr. President. I move the Senate re-resolve itself into the Committee of the Whole for the continuation of General Order second reading of bills.
You have heard the motion. All those in favor say aye. All those opposed, no. The ayes have it, and the motion is adopted. The Senate will re-resolve itself into the Committee of the Whole for consideration, General Order, second reading bills. And Senator Moreno will take the chair.
I know, I've called and they've called IT, so Morgan knows we're all trying to work on it, so sorry. So right now he is excused.
Oh, we're in Cal, so.
Can we go ahead or do we want to wait? I have to move Do I do anything else? Just move the bill so we can talk about it?
The committee will come to order, and the coat rule is relaxed for all in the chamber. Mr. Panetta, will you please read House Bill 1232?
House Bill 1232 by Representative Robertson, Judah, and Senators Donovan concerning the establishment of a
Senator Donovan.
standardized health benefit.
Thank you, Mr. Chair. I move House Bill 1232 and ask for you guys to continue to discuss it.
Colleagues, when we last left off, I believe there was an amendment on the desk. Mr. Panetta, will you please read Amendment L189?
Amendment L189 to Senate Bill 1232 by Senator Rankin. Amend re-engross
Senator
bill.
Rankin.
Thank you, Mr. Chairman. I move Senate Bill 189.
To the amendment, Senator Rankin.
Well, this is a good amendment. I have followed this bill in more recent times, certainly not in the early days of stageholding, but I've had two real concerns. One of them is that it doesn't give credit to those efforts that are already underway and have made a lot of progress toward reducing the cost of health care. The second is, I don't believe it adequately is concerned with geographic differences in the ability to achieve these results. And so I'd like to just tell two stories. The first one is about Peak Healthcare. Peak Healthcare started about 4 years ago in Summit County and has been very successful. And in fact, is the only healthcare alliance that's included in the bill and is given an exception for those counties in which it has achieved reduction. And it's fairly significant. And I'll just tell you a couple of those. It's started in Summit County and it spread to nearby counties, and then there was it was adopted down in southwest Colorado and picked up several counties. But here are the county reductions. San Juan County, 37% reduction over existing healthcare plans. Dolores, 37, Montezuma, 28, La Plata, 24, and then closer to Summit County's starting point, Grand County, 37%, Lake, 37. Tremendous. First of all, that shows what you can do with private sector competition, because that's what this is. This is a series of local entities banding together, negotiating with their healthcare providers, and going out and finding an insurance company who could manipulate it. Now, here's an interesting fact. In Summit County, their whole home county, 9.1% improvement. That does not qualify for the exemption. So, in their home county, in the home county of Peak Alliance, which is exempted from this, they have to start over, as I read it. In other words, they've done a tremendous job, achieved 9% reduction, and now by this bill, they have to achieve another 18%. That's ridiculous. I mean, that is the best example of a local public health care alliance, and this arbitrary threshold of 18% causes them to have to start over. So Summit County, then, the Peak Healthcare Alliance, we had some negotiations to try to move out into Garfield County. And here's the difference in geography. Because, what Peak did in Summit County was really very clever. 70% of their people were actually going to the Front Range for health care. What they did was negotiate rates that would allow the people to stay home in Summit County with Centura Health. It increased Centura's volume so that they could lower their rates. That's a unique aspect of geography because they were close enough to get access with another provider. So when we went to Garfield County, when we took Peak Healthcare out there and said, let's look at using Peak's model, it didn't work because nobody, there wasn't a nearby metropolitan area that they could pull back the volume for. And there were two different, a very different provider network. So geography matters. You can't do the same thing in every geography, and in some geographies it's difficult. So Peak is a great alliance, and I appreciate the bill giving Peak credit for those counties, but isn't it strange that Peak won't get credit in the very county in which they started? So the other story I want to talk about is the Roaring Fork Valley. Now, there's an alliance that was established actually in 2011 and has been very active since. It's not one of the so-called healthcare co-ops because it doesn't meet the criteria of our bill. But it's a 501c3, very organized with subcommittees to reduce healthcare in the Roaring Fork Valley. The Roaring Fork Valley is Aspen to Glenwood Springs, and it includes several different hospitals, but primarily Aspen Valley Hospital in Glenwood Springs, Valley View Hospital in Glenwood Springs. So that alliance has been very successful. They can show that they've reduced somewhere between, around 10%, 10 to 18% reduction in the rates that Rocky Mountain Healthcare charges there. But they don't count. They don't get any credit. They've got to start over. So why would that be? I mean, let's just take a look at this. They started in 1811. They pulled together the Aspen Ski Company, the city of Aspen, Aspen Valley Hospital employees, and then down valley they picked up all those parallel organizations all the way to Glenwood Springs. Well, they, despite that criteria, they weren't considered. Two reasons. They weren't 18% and they weren't one of those healthcare cooperatives. Why would that not count? So the current set of players in this are Pitkin County, Aspen Ski Company, the city of Aspen, Aspen Valley Hospital, Mountain Family Health Center, Valley View Hospital, and Grand River Medical Center in Rifle. So it goes all the way to Rifle. So that they're showing, they can show an 8 to 15% reduction in actual individual health care plans, those plans that we're talking about. Rocky Mountain has already responded to that, and Anthem, the only other provider in town, has also responded. So their argument is the Peak model doesn't fit them exactly because of geography, and they're already doing this great job, but yet they're going to be told that you have to start over. They have done some interesting things on their own without state government interference. They put in a primary care management system, which is the CMS Medicare model that we know is working. They use the same performance measures for quality. This is put in on a local basis that we're instituting in Medicare. So they're doing a lot of really interesting things. So basically what we need to do, and these are just two examples, what we need to do is give these folks credit for the work they're currently doing, not tell them they have to start over and do the whole thing. Now, Valley View Hospital is a little bit different. So I want to talk about what's going to happen to them. They're not a critical care hospital. They're not deemed an essential care hospital as defined in this bill. It's not clear what the criteria for that are, but what those are, but most rural hospitals are critical care, and they're given exception in this bill, and that's good. That's good, but Valley View is not. And so I asked them, I said, what's going to happen? What's going to happen because you're not given credit for the, up to 15% reduction that you've already achieved, and you got to start over? Well, they're already planning. They are planning on what to do. And there's, by the way, this has already happened in certain parts of the state. So first of all, specialty services. They have to cut their specialty services because they're not profitable. They can't achieve those kinds of cost cuts on doing those kinds of services. They have a fantastic birthing center. They've recently put in the last few years, they put in a heart catheterization facility so they can treat emergency heart situations, which will now have to go to Grand Junction by helicopter. They put in a cancer center that, you know, will not meet the criteria, will not allow them to meet the criteria. By the way, they're 30% of their work is Medicaid, Medicare already. It's already government health care that they must subsidize through their private side. They have a youth recovery center that's they say will not be viable, can't do it. Their mental health services would scale back dramatically. Their urgent care, they recently set up an urgent care facility that will close. And they're subsidizing the federally qualified health center across the street, Mountain Family. They will not be able to do that. So, you know, the impact is real, and they already know what it is. They're already planning for an impact of an 18% reduction because they're not given credit and they're not being, you know, their unique geography is not being considered. That's the reality of this bill. The reality is, you know, forcing everybody to start over and with a across-the-board, one-size-fits-all does not work. From my hospital, the one I go to and have been to, on emergency room and for other uses. So what this amendment does, what Amendment 189 does, it simply says that an organization that has set itself up to reduce healthcare costs will in fact get credit for the work it's already done. Why doesn't that make sense? Why would we not? Why would we not encourage them to continue on the path they're on rather than take these massive cuts in services, which are so critical to people in local communities? Why would we not encourage them to continue on the path they're on, wherever they are on it, and to achieve it as fast as they can? I mean, this one-size-fits-all 18% is not workable for the area I represent, and I don't believe for the rest of the state. So I encourage a yes vote on this. I don't know why we would not give these organizations credit and continue the work they're already doing.
Further discussion on Amendment L189. Senator Quorum.
Thank you, Mr. Chairman. I believe this is a very interesting amendment. You know, we have trouble when we start trying to create situations where one size fits all. And as the good senator from Carbondale talked about, there is a huge difference in the ability to provide health care throughout Colorado. You know, if I've got about 4 hospitals in my district, but when you get out on the Eastern Plains, you may be 100, 120 miles from the nearest hospital. So I think this is a good plan. I do know a little bit about the program. I followed the PEAK program. And I also know that in La Plata County, they've had some remarkable successes with that in La Plata. And I think it's something that is certainly worthwhile to consider. Ask for an aye vote.
Further discussion. Senator Donovan.
Thank you, Mr. Chair. I would ask for a no vote on this. It's again one of those amendments that is broad in its implications because of the number of carriers that it would include. And so I would ask for a no vote on L189.
Any further discussion on Amendment L189? Seeing none, the question before us is the adoption of L189. All those in favor say aye. Aye. Opposed, no? No. The noes have it, and the amendment is lost. Further discussion on House Bill 1232. Senator Smallwood.
Thank you, Mr. Chair. Thank you, colleagues, for being open and willing enough to spend the next 4 or 5 hours with me tonight. Go through the details of a very important bill. Now 1 to 2 hours. Thank you. And in all seriousness, I I do have a couple comments I'd like to make first, specifically to respond to the senator from Vail and her sort of opening comments about this, because this is a bill that I've had concerns with since the day that it dropped, and very typically in this building, if you're assigned to be the protagonist, the antagonist very rarely agrees to meet with you or have conversations with you or discuss ways to make a bill better. And that's not what happened here. So I want to give credit where it's due, because the senator from Vail has been extremely willing and open to chat with me through this process, and we came to agreement on some things, which I will definitely highlight. But more than anything else, colleagues, what I appreciate is the dialogue, is the conversation, because where we're going to end up with this is going to pass on a party line vote, or something equivalent to that, and it could have been a whole lot worse. Realistically, could have been a whole lot worse. And so I'm not going to take credit for any of that, but I do appreciate the conversation, especially in light of the environment that we're in right now. It's no secret for any of you that watched the last presidential debates, particularly on the Democrat side, there's a huge push nationally from one, I don't want to say a wing or a fringe or anything like that, but the Medicare for all, Medicaid for all conversation is very loud. So when you introduce a bill which was purported to be, initially at least, a public option, and with the chair's permission, I'll read one brief news article. This was published February 25th, 2018 in the Aspen Times. That says, and I am definitely paraphrasing, so I don't want anybody to say that I'm picking and choosing select segments. I am definitely picking and choosing select segments. I believed that 10 years ago, when I first ran for Congress on a platform of Medicare for all, and I believe it today. If I'm elected governor of Colorado, I will work with other Western states to tackle our shared healthcare challenges. Today, we can pioneer a groundbreaking multi-state consortium to offer a universal single-payer option out west. Okay? So probably no secret or no surprise, this was, at least according to the Aspen Times, a guest commentary by one Jared Polis, who's currently Governor Jared Polis. So when you have certainly a leader in our state being very transparent, mercifully very transparent, about the intent of creating a multi-state single-payer system, and when a bill is introduced that's talking about a public option, for those of us who not only oppose, but who genuinely fear a government takeover of healthcare, this brought my temperature up a lot, and I was thinking for sure that I would be on an island with nobody to talk to, because that kind of political pressure is out there. I don't think that is up for debate. That political pressure is out there, and I would go as far as to say that there are plenty of folks in this chamber, and certainly in the chamber across the way, who would love nothing better than to get us to that goal, to get us to a universal single-payer system. So, again, kudos. I'm glad to have conversations offline with anybody who wants to know how those conversations have gone with the bill sponsor, because my comments about this bill are not about the bill sponsor. It's about the bill, it's about the legislation, and you'll hear me refer to it as that and only that. So I get asked a lot why I care so much about this. Why is this my topic? Why is this the reason, if you go back to the 2016 election and look to see why Senator Smallwood ran for office, you are going to see high quality, affordable, accessible health care as one of those things that I ran on. And the reason being is because I have a father, and I have a brother, and I had a grandmother, and I had an uncle that are living and have lived the healthcare system both here and abroad. So my father's one, many of you have met him, retired Army, Purple Heart from Vietnam, and is living our VA system. And I will tell you, colleagues, the VA system of today is mercifully a whole lot better than the VA system of Shinseki's reign. And Shinseki, as you can imagine, is a patriot in pretty much every sense of the word. When bureaucrats take over healthcare, which you will see multiple times in this bill, the Commissioner of Insurance, as pretty much the sole person who's able to make a lot of these decisions, and I'm sure he's a fine person and makes great decisions, but I don't even think the Commissioner of Insurance would put himself at the same level of, I believe, General Shinseki. And so, if you've had family members who have lived through that period of the VA system and know how records were hidden and appointments were swept under the rug, it was not good, colleagues. And I got to experience it not firsthand, but secondhand, and be able to compare and contrast the systems. Second, I've got a brother right now, and I think there's only 2 people in the chamber that know this, but I have a brother who's diagnosed with either stage 3 or stage 4 cancer about a year ago. And today we live in a system where when my brother was told that you can't get treatment for your cancer here in the state of Colorado, and he goes to a different state and is told, you know what, we're not comfortable giving you this kind of treatment. And many of us were resigned that this is just something that he was going to have to live with. And then to find out that instead, because of our system, he can hop on a plane, go to Houston, Texas, to MD Anderson, go through an 11-hour surgery that they wouldn't perform here in Colorado, or said that they weren't comfortable, and basically come back and be, knock on wood, thank God, in really great shape. That's something I don't take lightly. The freedom and flexibility that we have, that when we're told no by the health system, it's no problem, we get on a plane, okay? And when you consider that situation, and then think of my grandmother, lived her entire life in Germany, always under their national healthcare system, and to watch the last few months of her life, and to see how that healthcare system treated her compared to how the healthcare system treats people in our country, and to watch her pass away, and then 2 years later, to watch a younger uncle, not older than several people in this room, who's not from Montrose, and to know deep down that more could or should have been done for him, and to be with him almost the last few months of his life, and watch how he couldn't get the care and go back in and been told to go home, and then go back in and be told to wait until he finally simply passes away in his living room, which is exactly what happened. I think he was 72. That terrifies me. To be told by the system, this is how care is going to be delivered. And I'm not asserting that this bill is taking us to Germany's system or Canada's system or Great Britain's system, but the fact that so many people want to see this happen, and after this bill passes, what you are going to see is folks coming back to the legislature saying, you know what, this bill, 1232, good bill, but gosh, it just didn't get us there. We need more. We need more, we need more, we need more, and colleagues, you will continue to hear, we need more, we need more, we need more, until we have a system where the government controls everything, and there are no direct premiums that are paid, and there is no cost sharing for services. Then and only then will that voice start to get a little quieter, and you'll hear the other voice start to get a little lower. the voice that I hear when I heard when I lived in Germany, that I hear when I visit Germany, that you've probably heard from people in other countries, which is no longer about cost, colleagues. It's about access and quality. And that's why people come to this country. So that's why I care so much. It's not political for me. It simply isn't. Shouldn't even be partisan, the way I look at it. It's simply your opinion as to whether or not you should be in control of your health care or if the government should be in control of your health care. And remember, this is what I do professionally. The other, what's supposed to be 8 months out of the year, which who knows how long it'll actually be. The other 8 months out of the year for the last 28 years, I've dealt with patients and employers. And a big part of that is making sure that they get the care that they need when they're told no by the system, that they get their bills paid the way that they're supposed to get paid. When somebody's not playing by the rules, a hospital, a doctor's office, a pharmacy, an insurance company, this is pretty much all I do the other 8 months out of the year. Trying to work to balance here in this country what people can afford to pay in premiums and what their employers can afford to pay versus the quality, the access and the quality. And that's exactly what we're going to get into in this bill, because right now there's really, I think, two things to talk about. One is easy, and this is the part where I'm disappointed. I'm disappointed to see good amendments voted down because it's the technical side of this. This is a big bill that covers a lot of people. And to know that there are technical flaws in this bill that people on both sides of the aisle agree are technical flaws. You just heard one from the senator from Carbondale. That's a technical flaw. And technical flaws are ones that the proponents have made changes along the way, and I wish would continue to make changes. And we can get a lot of those resolved today. I've got a handful of amendments. You missed the vote, apparently, on probably the best one from the senator from Carbondale. And the rest of that, after that, colleagues, it's going to be a policy disagreement. Plain and simple. Do you think that the government should step in and to some extent conscript doctors and treat our hospitals more like a utility? And there are lots of people in this country, in this chamber, and particularly the chamber across the way, that absolutely think that. They think that doctors and optometrists and dentists and hospitals and pharmaceutical companies should be treated like utility. And that is what this bill does. I don't believe that they should. Lots of people believe the opposite. So I'd like to start with kind of some of the policy disagreements first, because I've got some amendments that I'll introduce that I think will help with that, which is really just kind of the economics of this. Do you believe from an economic perspective that if you tell hospitals in this particular market you can only charge this much, or you tell doctors you have to cut your rates to this, do you really believe that the doctors and the hospitals are just going to do that? Do you think that they are going to earn less or a lot less or lose money, depending on who you talk to? And we heard testimony on all of the above. Do you think that they're really going to do that? Do you believe that? Or do you believe instead that they are simply going to either cost shift, meaning I can only earn this amount of money by taking on the individual insurance members in Colorado or the small group members in Colorado, so I guess we're just going to lose money? Or are they instead, colleagues, going to look to the large group space or the self-funded space and instead say, you know what, I'm going to charge those people a whole lot more? Because in the bill, you may hear, well, we've addressed that, but we haven't addressed that. We might try to shine a light on it as best as possible, but we certainly haven't stopped it. And nobody's even talked about how to stop it. How are you going to stop it in the self-funded world, where most employers in our state have all of their employees? Somebody come to the well and tell me how we're going to stop that cost shift. So economics is the first piece of it. And the other piece that I'm even more worried about is we don't live in a country like Germany or Canada where a physician has to literally leave their homeland if they want to escape the rules of the healthcare delivery. Here in Colorado, colleagues, if you're a doctor, all you do is you pick up your practice and you go to a more friendly environment. You go to Texas, or you go to Wyoming, or you go to Arizona. In fact, if this bill passes, you can go to probably almost any state and find a more friendly environment to practice medicine. So from the economic perspective, I just don't believe it. Like Public Enemy would say, I don't believe the hype. One thing that would be helpful, I think, is as we go through the bill and the amendments is, I think we can all agree to stop calling it a public option, or maybe even a Colorado option, because of the changes in there. And I'm going to conclude with a couple things, which would be that what you've heard from this bill is that it's going to lower costs. And I would say that when we, well, most of you won't be here by the time most of this takes place, but you're going to find that this is not going to lower costs. Because the provision in the bill, when you ask the proponents and say, well, how is this going to lower costs? The answer is, well, because insurance companies have to lower costs. It says right in the bill, they have to lower costs. Well, your next question should be, well, what happens if they don't lower costs? And the answer is nothing, really. They go in front of the Commissioner of Insurance and say, we couldn't lower costs. Second, you've heard that you're going to see better benefits. And what I'm proposing, colleagues, is that that is arithmetically impossible because of the constraints in the bill regarding making sure that these plans, these standardized plans, are created in metallic tiers. I'm not going to bore you with the details of actuarial values, but metallic tiering is metallic tiering. And if you're going to take a primary care physician copay to zero, then you're going to have to increase a deductible. And if you lower a deductible, you're going to have to increase an out-of-pocket maximum. You're going to have to do something to keep the actuarial values intact, and that's what the bill prescribes. The Commissioner of Insurance, colleagues, is not allowed to build whatever health plan today he or in the future she might want to build. You're not allowed to do that. You have to build a bronze plan and a silver plan and a gold plan. And those are defined by the federal government using AV calculators. And for those of you who are interested, just hop on CMS's website and pull up actuarial value calculator and play around with it for 10 minutes yourself. Pick a deductible, pick a copay. See, is it a bronze plan? Is it a silver plan? Is it a gold plan? Try to build your own with great benefits. And guess what will happen? The constraints of the actuarial value calculator prohibit you from doing these things. You can't do it. CMS.org, I think. Build your own. So the benefits aren't going to be better. They might be different, and they will be standardized. I don't want to take anything away from the proponents on that, but they're not going to be better. Bronze is bronze, silver is silver, gold is gold. You've heard that the care here is going to be more equitable. This is my favorite part of the conversation. I wish the senator from Aurora was here with us. Maybe she is. Because she asked great questions in committee. Well, the other senator.
Real cool, Smallwood. Real cool. Yeah. Your questions were cool.
Your senator were great also. But the specific questions that were asked in committee were, tell me how this plan is going to improve health equities. That's the question she asked in committee. Tell me, what is it in these benefit plans that are going to help persons of color in our state? I don't know about you. I never heard an answer. My colleagues would like to come up and tell me where I missed something in committee. Tell me what you're going to build specifically in a plan design that is going to help our communities of color. You know, the one thing that I heard, well, senator from Douglas County, we're going to have better perinatal care. As if perinatal care cares whether a person is Asian American or African American or Latino or Latina or white. That's the only thing in the bill specifically called out as something that's going to improve health equity. I would love for somebody to come up here and tell me why, for example, somebody who is Hispanic is going to benefit less from proper perinatal care than somebody who is Asian American or who's black. Somebody come explain to me why perinatal care is important for some ethnicities and not important for other ethnicities. Because it's important to everybody. So to improve perinatal care, and by the way, I think the senator from Commerce City already ran and maybe even passed a bill this session that is going to already make all of that free. Things like testing for sickle cell, which is the one thing in racking my brain that I could come up with that is possibly directly related to health equities, and the good senator from Commerce City already ran the bill to fix that. So I have not heard from anybody how a plan design is going to be built that improves health equities in our state. So when you hear that, I would encourage you to do what the senator, my good friend from Aurora, did, which is ask specifically in the bill what is going to change in benefits to improve health equity. Because I would argue nothing that they're going to do is going to improve health equity within a plan design. Proper perinatal care? Sorry, colleagues, I don't buy that. It's good for everybody. Finally, what you heard was that you're going to see a plan that offers more access, not less access. But it's very clear in the bill that the insurance companies are going to be operating on the exact same networks that they operated on before. And now that we've stripped out the requirement for physicians to participate or otherwise face a fine, how can you tell me with a straight face that you're going to have more doctors participate in this, knowing that they're going to be paid less? And my biggest concern with all of that access piece is that when you tell doctors or hospitals that they have to take a lower reimbursement, what is going to stop those doctors and hospitals from cutting off care to the people that need it the most? What is going to stop that doctor who used to take Medicare and Medicaid patients, now thinking to themselves, look, I only make this on Medicare and Medicaid patients. I make this on my commercial patients. Now you're going to cut my reimbursement to commercial patients. Are they really going to have the appetite to continue to see Medicare and Medicaid patients at the volume that they're seeing them today? I worry about that, colleagues. Again, we'll all be, most likely, most of us won't be in this building when that happens, but it's going to be so subtle and so invisible as access gets more and more reduced year after year that nobody will ever be able to tie it back to this bill. Not in my opinion, anyways. So really, at the end of the day, what we're facing is a standardized plan that tells hospitals how much they can earn when the rate targets aren't met, and they're not going to get met. That's my prediction. And we'll come back and debate it. I'm here for 3 more years. We'll come back and debate it. We'll see who was right and who was wrong. But when rates aren't cut, and all of this rate setting does happen to hospitals, and they're still facing the possibility of getting their license suspended, and thank you to the proponents for agreeing to where at least they're not revoked anymore. Now they're just suspended. You can't go to the hospital just for a while now. But I think what you're going to see is a plan that is going to be very much like what happened in 1994. And I'm sure you all remember House Bill 94-1210, which was the last time we told the Commissioner of Insurance to build standardized plans. And I think it was she then did. And the commissioner built a basic plan and a standard plan, exactly the way the legislature asked them to back in 1994. And guess what? Nobody bought it. And so now they're gone. They were killed with the Affordable Care Act. So really what we're going to be looking at is a plan here that nobody will buy, that doesn't lower costs, that doesn't offer better benefits, that's not more equitable, that doesn't include greater access, and certainly doesn't include greater quality. But what it will do is get us further down the road, colleagues, of the people who want single payer can shout from the rooftops. We passed a bill that got us closer to single payer. And when we come back in next legislative session, and the legislative session after that, and the legislative session after that, to continue working on this on our way towards single payer, those people can be on the West Steps, have the podium there, a bunch of people cheering that we're moving, again, one step closer to the single payer that we were promised in 2018. So I've got a handful of amendments. I've shared virtually all of them, I think, other than one I drafted recently with the bill sponsor. And what I'd ask is on the first couple, for the 11 of you that are left, that we pay close-ish attention to the first couple, because these are the ones that people from both sides of the aisle have said, you know, this makes a lot of sense. I like this idea. Why don't we do this? Why have the proponents not said yes? And I will say, I have not received answers to my satisfaction anyways as to why they shouldn't be yes. So we'll start there, and I don't have that many. So my goal is not to keep you here beyond your level of interest, but it is one of the most significant bills we'll hear all year. So with that.
There's a pizza at the desk.
There is an amendment on the desk. Mr. Panetta, will you please read Amendment L162?
Amendment L162 to
Senator
House Bill
Smallwood.
1232.
Thank you, Mr. Chair. I move Amendment 162.
To the amendment, Senator Smallwood.
Thank you, Mr. Chair. So what Amendment 162 does is it asks the question that I'm hoping all of you asked if you represent people in the Front Range of Colorado. And many of you don't. Many of you represent rural parts of our state. As you'll remember, and I'm not going to spend a bunch of time going back in history, but we were told not too long ago that if we just passed the reinsurance bill, we wouldn't have to hear any more health care bills here in the General Assembly because we will have fixed the health care cost problem because we would have had a reinsurance bill. And what you probably also remember was that after the reinsurance bill passed, the net impact to our lowest income citizens on the Front Range who purchase subsidized coverage on the exchange, the rates went up. So in Jefferson County, and in Arapahoe County, and in Boulder County, and in Adams County, and in Douglas County, and in Weld County, and in El Paso County, and Larimer County, the rates, and in Denver County, there's a handful of you, I think, like 18 of you that are from Denver, the rates for your constituents went up. That is not debatable. The rates went up for the poorest people purchasing subsidized coverage in the Front Range. You all remember that. It was not good. In fact, it was so not good that we ran another bill afterwards saying, hey, if we pass this, we won't have to talk about health care in the General Assembly anymore because we will have fixed health care affordability so that we don't need to run any more health care bills. If you just pass the health insurance affordability enterprise, which we did. We had to do that, and we had to tax all of the rest of the purchasers in our state, 1 to 2% of their premiums. We had to levy that tax on their health insurance premiums to fix exactly what Amendment 162 addresses. Amendment 162 says that when the Commissioner of Insurance goes to apply for this waiver, which is a linchpin, as I understand it, of this bill being successful, is that during the state innovation waiver application, there's a requirement that the state of Colorado maintain or increase the level of federal advanced premium tax credit funds and resulting premium affordability subsidies available on the non-standardized qualified health benefit plans offered on the exchange. I'm not going to read the entire thing to you. But what this will do is prevent, that's all it does, is say, if the same disaster that was the reinsurance implementation happens with this, guess what, colleagues? We're not going to do it because we shouldn't do it. Because what this bill is supposed to do is lower people's health insurance costs. So this is saying if the net premium increases just like it did after we passed reinsurance, then we're not going to do this. And this isn't helping the wealthy people in our state, this amendment. This isn't even really probably helping the middle income people in our state. This targets specifically the lowest income earners on the Front Range who purchase subsidized coverage and need that. I have yet to hear why we shouldn't do this other than, oh, don't worry about this, Senator. It won't happen. It won't happen again. We've learned a lot over these last few years about how to do this. So if you care about the lowest income earners on the Front Range, I'd encourage an aye vote on Amendment 162.
Is there further discussion on Amendment L162? Mr. Minority Leader.
I've got it up here. Yeah.
Thank you, Mr. Chair. I rise in support of Amendment 162, otherwise known as L162. In my remarks earlier today, I expressed frustration that out of all the emails I've received, I saw one, I'm aware of one email from someone in the healthcare profession who supported this bill. I did hear from many constituents in a form email that suggested that I campaigned on providing lower healthcare costs, and out of the 4 campaigns I've had, I don't remember that piece of literature or that claim. But I do know that I'm looking to have less government interference in the doctor-patient relationship and in the relationship between a health insurance company and their customers. Amendment L162 gets to that point, in my opinion, in that there are people who have advocated to me that they want better access. They want lower cost. But it's unusual when I hear from people in the district that I represent, because that's entirely on the Front Range. My colleague, who is also from Douglas County, has made that point. When reinsurance happened, we in those communities paid more. Why? Because the total cost went up and it shifted the burden from people in more rural parts of the state to people in the parts of the state like where I live. And I wonder sometimes if people who live in the communities that I represent understand that. Because now some of them are saying, do it again. Do what? Make health care less expensive and more accessible. And I don't want to get in an argument with a constituent, but apparently they don't understand That didn't happen for them, not where we live. And I'm not pointing fingers at people like on the Western Slope who might have seen a reduction. That's what reinsurance was intended to do. So 162, as my friend from Douglas County has explained, supporters of this bill have maybe indicated that, well, that cost shifting won't happen again. Oh, okay. 162 would say if it does, it can't. I mean, you don't just make other people pay more. So if this is really about lowering cost and providing better access, let's put this guarantee in there that the easy answer won't be the one that is used again. Some people might pay less, and if that is true, then other people have to pay more. No, that's not what this bill is supposed to be about, so let's support 162. Ask for an aye vote.
Is there further discussion? Senator Lundin.
Fair enough. Thank you, Mr. Chair. When we have these conversations around the government intrusion and regulation of marketplaces, we hear phrases and we write language to prevent cost shifting, to make sure that hospitals aren't shuffling money from here to there and at the disadvantage of one group or another. But we never think about the cost shifting government is putting upon the people, who at the end of the day are the ones being served, hopefully, by the healthcare system. This amendment seeks to say, don't do that. Don't do that. Don't shift the costs from one group of people to another group of people. And we've experienced that. I mean, we have recent, real experience where individuals on one side of a continental divide were in fact being subsidized by individuals on the other side of a continental divide. The reality is that's probably not appropriate for us, by the authority of government, to shift the cost from one group of people to another. So, Amendment 162 says, hey, here's language that would prevent that. It seems an obvious sort of thing you want to do if equity and even-handed and straight dealing among the people of Colorado is your preference. Certainly that's my preference, and so I rise in support of 162.
Is there further discussion on the amendment? Senator Donovan.
Thank you, Mr. Chair. So we did do a study that showed that reinsurance was not the cost of premium increases. I think I have that somewhere in my office, but I don't have it handy. And I would ask for a no vote on this amendment. We can't put these specific limitations on the waiver application because this is a federal process, so I'd ask for a no vote.
Seeing no further discussion, the question before us is the adoption of Amendment L162. All those in favor say aye. Aye. Opposed, no? No. The noes have it, and the amendment is lost. To the bill. Senator Smallwood.
Thank you, Mr. Chair. So I hope that doesn't set a precedent how the rest of these amendments are going to go. That'd be very disappointing. Although something similar to that did happen in the Health Committee, so I won't be overly optimistic here. But perhaps you've read the recent Milliman study. No. So the actuarial firm of Milliman was commissioned to take a look at the impacts of this bill. And if you think that Milliman is just no good and bunch of folks doing this stuff in their garage, then you may want to check with the folks at PARA. I believe they use them. I think the state brings them on for consulting often. What I was able to extract from that Milliman report is that there is a concern that you should all have that the reimbursement levels that are set up in this bill are actually, colleagues, higher in some cases than what the insurance companies currently have negotiated with the hospitals. So I'm going to repeat that. Inside the bill, according to Milliman, hospitals will make more money than they would today. So that's not my data, that's not my inference. This is coming from Milliman. Why in the world would we want to do that? And how in the world will that get us moving towards lower healthcare costs for the citizens of our state if the hospitals are paid more in any situation than they are today? So I have Amendment 166 that will plain and simply, this does not stop the bill like what I would have loved to have you do before your low-income citizens' rates go up by accident. This says that we're going to move forward regardless. But when rate setting the hospitals, which is going to happen because the insurance companies aren't going to meet their rate thresholds, what we're not going to allow happen is to have the commissioner of insurance go in and tell the health insurance companies, hey, thanks so much for negotiating with the hospitals all this time, but now you've got to pay them more than what you were paying them. That's what Amendment 166 does.
There is an amendment on the desk, and colleagues, I am going to encourage you to provide your amendment to the desk before you speak to it. Mr. Panetta, please read Amendment L166.
Amendment L166 to House Bill 12.
Senator Smallwood.
Thank you, Mr. Chair. I'm going to take your comments to heart, Mr. Chair, after we go through this one and try to make this process a little easier. What you'll see in Amendment 166. I move Amendment 166, Mr. Chair.
Do the amendment, Senator Smallwood.
Yeah, thank you. What this amendment does, if you look at the bill, the portion where the commissioner starts going in and doing rate setting, this inserts some additional language. I'd like for you to just briefly read it or at least listen to it so we know what we're talking about. The insurance commissioner shall not demand an increase in the reimbursement rates in excess of medical inflation from the current rate the hospital, health system, or healthcare provider has negotiated with the carrier. That's all it says. It says it in 3 different places. It basically says, if the insurance company already did a better job than what the bill proposes, why in the world would we want to undo that? The bill keeps moving forward, doesn't end anything, but let's try to keep rates as low as we possibly can. This is common sense, and I encourage and I vote on Amendment 166.
Further discussion on Amendment L166. Senator Donovan.
Thank you, Mr. Chair. This was the one that he alluded to that he thought of recently, so I'm reading it in real time. It's exciting television for those 7 of you watching at home.
Including your cat?
Including my cat. Mr. Chair, can I request a senatorial 5?
Committee will be in a senatorial 5. All right, we are to Amendment L166. Senator
Thank you. Thank you, Mr. Chair. I'm going to ask for a no on L166. I do believe that this could hurt the hospitals, and our negotiations with them have been so tight over the past 4 months that I do think that introducing this would go back on negotiations we've made. So I ask for a no vote on L166.
Senator Lundin.
Thank you very much, Mr. Chair. So we have an objective. We know where we want to go. More affordable health care. This amendment simply says those that get a green check mark on achieving the goal don't have to comply with all the sophistry, the smoke, the mirrors, all the wonderful things that we write into the law books. They say, thank you for doing what we're trying to do. How did you do that? Maybe we could learn from. No. The sponsor says it's not about the objective, it's about writing the law. It's about creating this big apparatus. This is a check done. Those that are achieving the goal that is set before us, in fact, this would allow them to do that without having to jump through the hoops of the laws that we create. I urge your support for 166 because it's about getting it done and allowing those who have gotten it done to move forward with their business. You know what? We should be asking them how to scale, how to do that again and again across the state, instead of saying, no, we're the government, we know better how to manage your business than you do, do it our way. This is a good amendment. Vote for it for those who are getting it done.
Further discussion. Mr. Minority Leader.
Thank you, Mr. Chair. Well, I think the outcome of Amendment 166, we're above that, but we're back to one that was drafted, the 166th amendment that was drafted this bill. But I think we know the outcome. The sponsor has asked for a no vote. Okay, I count her as a friend. I'm not here to disparage her. We have a disagreement about this policy. Earlier today, I made the observation that this bill, House Bill 1232, isn't your story. The people out there who have healthcare stories, challenges of disease, surgery, accidents, whatever, access to healthcare. You have stories. Don't mean to disparage any of those stories, but this bill isn't those stories. And this amendment to this bill, Amendment L166, addresses one of the observations I made earlier. Because this bill isn't about the stories about why people want lower health care costs and better access, I compared this bill to a tax form and the instructions that are provided by the IRS for how to fill out a tax form. That's the way this reads. It doesn't talk about compassionate stories about saving lives or making the health of people better, because bills can't do that. The stories and the policy, two different things. Earlier today, I talked about how tax preparation services, they don't talk about the boring forms. They talk about what people might use their tax refund to pay for. That's fun. That's exciting. This amendment addresses one of those mundane factors of these words and numbers that are this bill. Again, this bill isn't about anyone's story, healthcare story. This bill is about how costs will be redistributed, shifted among people here in Colorado. And this amendment is a good amendment. But the bill sponsor has asked for a no vote, so she represents the majority party and I represent the minority party, so the outcome is probably predictable. But this kind of control on an unelected bureaucrat within government who will have immense decision-making power over your health care, people of Colorado. If you're watching this, I think the bill sponsor guessed that there might be 7 people actually tuning in. Maybe there's more. But if you're watching this and you think you want this bill, then have you advocated to any of us, Senator, please vote yes on 1232, because I want one person in government to have even more control over my healthcare decisions and how much I pay. And that wouldn't be your doctor. Nope. It'd be an unelected bureaucrat within our state government, the Commissioner of Insurance. So if you don't want that Commissioner of Insurance, that one person, to have more control of your decisions of where you get health care, how much you pay, what the treatment is that you receive, if you don't want those things, then 166 is a good amendment to support. And if you do want those things, why in the world do we keep talking about this bill as providing better access to health care and lower costs when that's not what it is? Ask for an aye vote.
Senator Smallwood.
Thank you, Mr. Chair. So, colleagues, this is one that we're all going to get to raise our hands on later on, so I want to make sure I've explained it okay. Or not raise your hand. And colleagues, I'm not trying to be crass with this, but I don't really care what part of the lobby likes and dislikes other things. I really don't at this point, because I will tell you from what I've heard, everybody hates this bill. The insurance companies hate the bill. Well, not everybody. Virtually everybody that I talk to hates this bill. The hospitals hate this bill because they feel they're getting rate set and potentially facing a suspension of their license. The doctors certainly hated this bill because of the fact that they are prescribed by law to participate in the standardized plans. The consumer groups will come back and tell you after this passes that they still hate this bill because it didn't change deductibles, didn't lower their costs, didn't make everything free, didn't actually provide health equity. So the consumer groups, 12 months from now, are going to tell you that they hate this bill. So I would say, let's not listen to the doctors or the hospitals or the insurance companies or to the consumer groups or to the Division of Insurance or to the first floor. Let's instead do what's right for the consumer of healthcare with this amendment that says if an insurance company has already negotiated a lower cost than what is in the bill, that number stands and that we're not going to give a higher reimbursement rate when we don't need to. So, again, would very much encourage this go-around an aye vote on Amendment 166. Thank you.
Further discussion on L166. Seeing none, the question before us is the adoption of Amendment L166. All those in favor say aye.
Aye.
Opposed, no. Noes have it, and the amendment is lost. There is an amendment on the desk. Mr. Panetta, will you please read Amendment L186?
Amendment L186 to House Bill 1232.
Senator Smallwood.
Thank you, Mr. Chair. I move Amendment 186.
To the amendment, Senator Smallwood.
So if you hated the last amendment, you're going to hate this one even more. Because this is saying that the 18% cost reductions that you've been hearing about, the whole reason for the bill to lower health insurance costs by 18%. If a health insurance company just did that and they just lowered their rates by 18%, that we can say they get a pass because they already lowered rates 18%. if we don't pass this amendment, then we're not telling the health insurance companies, and remember, they're not going to meet any of these numbers anyways, so it's sort of a moot point, because this is saying if you've already met 18 and you vote no for this, the insurance companies need to meet another 18, so they're going to lower their rates by 36%. So if you didn't believe me that it's an arithmetical impossibility that they lower rates 18% from where they are today, you really should be skeptical that they can lower them 36%. So I'd ask for an aye vote on Amendment 186.
Further discussion on Amendment L186. Senator Donovan.
Thank you, Mr. Chair. Ask for a no vote on this amendment. It tries to equate carriers and co-ops. I do not believe those are equivalent, and would ask for a no vote.
Senator Smallwood.
Thank you, Mr. Chair, and I apologize to the bill sponsor. I wasn't able to hear her response on that. I thought I heard co-ops, but this is just saying insurance companies who've met that rate reduction don't need to meet another rate reduction. So I apologize. I literally couldn't hear you. So.
Further discussion. Senator Lundin.
Thank you very much, Mr. Chair. I rise in support of the amendment. This is one of those, and you've heard me use this phrase before, this is a put your money where your mouth is amendment. It basically says if you're doing the whole purpose of the bill, if you've achieved the purpose of the bill, then that's good enough. We should support that. And folks, we actually have got data coming back that's telling us in many cases that is what's going on. Since 2019, average premiums on the Colorado ACA market have fallen by more than 20%, according to an analysis done by the Common Sense Institute of Division of Insurance of the Division of Insurance data. So I think we need to be serious about rewarding success if we want the people for whom we are legislating to hold us in any degree of credibility. This amendment would in fact empower the people to hold us to account. I think it's a good idea, a good amendment, and I urge you to support it.
Further discussion on Amendment L186. Seeing none, the question before us is the adoption of L186. All those in favor say aye. Aye. Opposed, no. The noes have it, and the amendment is lost. There is an amendment on the desk. Mr. Panetta, will you please read Amendment L160?
Amendment L160 to House Bill 1232 by Senator Smallwood. Amend reading gross bill, page 6, strike lines 25 and 26, renumber succeeding subsection accordingly. Page 7, line 7, strike.
Senator Smallwood.
Thank you, Mr. Chair. I move Amendment 160.
To the amendment, Senator Smallwood.
Thank you, Mr. Chair. Colleagues, you learned, like me, through reinsurance and unintended consequences, that it might be good to start small and test out a theory, which is all this is at this point, is a theory that it might work. No other states have done something exactly like this. In the event that this theory proves to be as incorrect as some of the last theories that I promised I wouldn't keep bringing up, then wouldn't it be good that we confined those blunders to as small a market as we possibly could? So this is saying if we want to try this experiment, let's do that in the individual marketplace. We're not going to impact Colorado's small businesses. In the event this doesn't work, in the event that what happens is the opposite, that rates go up, which we weren't willing to adopt an amendment to prevent from happening. So that's what this simple amendment does, takes this down to something that will potentially mitigate some damages, and I'd ask for your aye vote on Amendment 160.
Further discussion on Senator Donovan.
Just stay up here.
Huh?
Just gonna stay up here.
No, it's impolite for me to do that.
Thank you, Mr. Chair. I ask for a no vote on this. This would remove the small group entirely from this bill. Actually, in some of the most compelling testimony in both committee hearings was how small businesses are really excited to be able to have a more affordable healthcare product and have more choice. And if we take out small group, we kind of take out small business from the bill, and I think that would be very sad. So I ask for a no vote on L160.
Further discussion on L160. Seeing none, the question before us is the adoption of L160. All those in favor say aye. Aye. Opposed, no? No. Noes have it, and the amendment is lost. There is an amendment on the desk. Mr. Panetta, will you please read Amendment L167?
Amendment L167 to House Bill 1232 by Senator Smallwood. Amend reading gross bill page 6 lines, strike lines 4 through 10 and substitute 10. Medical cost trend means the projected percentage increase in the cost of the three payments from one year to the next, which estimates the projected increase in per capita cost of medical
Senator
services.
Smallwood.
Thank you, Mr. Chair. I move Amendment 167.
To the amendment, Senator Smallwood.
Thank you, Mr. Chair. Colleagues, I am so grateful that we don't use the term medical cost trend or medical inflation all that often in deliberating bills here, because they're highly nuanced and the definitions matter. So the original bill tied a number to medical inflation that is pretty much at the discretion of one individual, the Commissioner of Insurance, who I don't know, on an aside, if somebody could go through the bill and count the number of times the Commissioner of Insurance is mentioned in the bill, I think the running total was 22, but I'm not sure. So I don't know if the drafter has an easy way to do a word search on that. But because I'm kidding, you don't really have to do that. Because we're doing so much related to that office, the Division of Insurance, might it be smart for us as the legislators to, instead of taking the Commissioner of Insurance's office as the gospel when calculating what medical inflation is, how about we do what we've done lots of times in this body, which is bring in an independent third-party actuarial firm that is nonpartisan to tell us exactly what is medical cost trend, because it's in the bill. It offsets the increases that are built in here. So right now we have the choice of just saying the commissioner can do this solely at his or her discretion. This is saying, is that really a smart thing? Or is it worth spending a little bit of money to make sure that we're making the right decisions here for the doctors, hospitals, those folks that are receiving these reimbursements across our state, so that we know the number's fair? This doesn't kill a bill. This doesn't stop things from happening. This simply says the commissioner doesn't have the sole authority. Let's have an independent, nonpartisan actuarial firm with expertise in healthcare financing and analysis figure out this number for us. I'd ask for your aye vote on Amendment 167.
Senator Donovan.
I feel like we're getting into a rhythm. Thank you, Mr. Chair. I'm going to ask for a no vote on L167. The sponsor of this amendment did cite the importance of the numbers that and the trend lines that we project and work from. Moving that at this point would impact that the savings that our constituents would see. There's also a concern too that the insurance companies may be able to increase quicker, thus also impacting savings for our constituents, and I ask for a no vote.
Further discussion? Seeing none, the question before us is the adoption of Amendment L167. All those in favor say aye. Opposed, no? No. The noes have it, and the amendment is lost. There is an amendment on the desk. Mr. Panetta, will you please read Amendment L190?
Amendment L190 to House Bill 1232 by Senator Smallwood. Amend reading gross bill page 27 after line 17, insert 1016, 13, 14, repeal of part. This part 13 is repealed effective
Senator
September
Smallwood.
1st.
Thank you, Mr. Chair. I move Amendment 190.
To the amendment, Senator Smallwood.
Thank you, Mr. Chair. In the event this is a disaster, maybe we should have something in place that repeals this. None of you will be in this body at the time this repeal happens. Hopefully, you're all still on the planet. But this is going out to 2031. If this is an unmitigated disaster, there is a backstop. There is something in place that says we're going to repeal this in 2031. And colleagues, let's be honest, if this is working great, nobody's going to want to repeal this, and we've got an entire decade to make sure that that doesn't happen. This is a very common sense amendment and might not have been had it been what I would desire, which is a 3-year repeal or a 5-year repeal or a 7 or an 8 or a 9-year repeal. This is a 10-year repeal, and I'd ask for your aye vote on Amendment 190.
We call those 3-year repeals court amendments. Senator Janal.
Thank you, Mr. Chair. I support Amendment L190 because I do believe in sunsets, and I think it's a good way to have a check and balance on what's going on with the bill. In fact, we heard one bill in committee today that was brought back for the 3rd time because it was passed in 2012, never got reviewed, never had any enforcement. Another bill came in 2014, same thing happened. No one was watching out for it. And so we're running it again in 2021. I do believe that giving this bill 10 years and then checking on it, seeing if there's good things that have happened, if there's things we need to change for the better, then let's do it. I rise in support of L190.
Further discussion. Senator Donovan.
Thank you, Mr. Chair. I would point to line 2 of this for all the advocates that are watching, hopeful to see a bill passed that lowers cost and increased access. This amendment would repeal this entire bill. Part 13 is the bill, so this amendment appeals House Bill 1232. If there are concerns on how this policy is implemented, if this body, after seeing it through the SMART Act hearing or being engaged as general responsible lawmakers who pay attention to things, are seeing that there are issues with the policy procedures, how it's being implemented, run new legislation. We'll fix it. But if this bill gains the support of this body tonight to pass, and tomorrow on 3rds gets passed by this body, and then the bill begins to be implemented, we will have delivered something meaningful to people across the state, and that will be consumer choice at a lower cost. They will have started to depend on that. They will have started to build their budgets around it. They will have depended upon this insurance product, and this amendment takes that insurance away from them. It's a repeal of insurance for our constituents, and I would ask for a no vote on L190.
Mr. Minority Leader.
Hi, buddy.
How are you?
Do you want that one or this one?
I'll stay here. So if this is working and people are paying less for better access, and this amendment were adopted, then it wouldn't have an effect. It would continue. If the opposite happens, which is what's going to happen, that costs go up, choice goes down, cost goes up, then this would repeal. And I support Amendment 190. That's a lot.
There's a lot.
That's a lot of amendments. Now, they didn't all occur here, but between the House and the Senate, 190 amendments. If this amendment is in the bill, then those of you who will be here in the future could avoid the highly predictable scenario. What happens when anyone dares suggest that any part of the Affordable Care Act should be repealed? They're attacked and criticized for taking away coverage, a government plan that allegedly helps people. Social Security, same thing. When was the last time you remember government, state or federal, saying, we're going to repeal this program, and everybody said, yes, let's do that, it's not working? I don't think that happens very often. So this is an amendment to say, okay, if that happens, then those of you who are here then, I don't think that'll be me. Next session is my last. But those of you, well, you too, I think. Aw. Those of you who are here, you won't have to go through that brain damage of, no, it didn't work. Instead of increasing costs, increasing access and reducing costs, it increased costs and reduced access. Oops. The good senator, the good one from Douglas County, who works on this professionally, he was right. But you won't even have to admit it then, because this amendment, if it is added to the bill, would take care of that problem for you. It wouldn't be an embarrassment or anything. It was just like, whoops. It didn't do what the supporters said it was going to do. It did what the good senator from Douglas County accurately predicted. This goes away. That's where I vote on Amendment 190.
Is there further discussion? Senator Smallwood.
Thank you, Mr. Chair. And one final comment on this. You know, we hear sunsets all the time here. It's never anything scary when we're looking at a practice act or an occupation. Nobody thinks, oh my gosh, we're going to get rid of dentists in the state of Colorado, or we're going to get rid of landscape architects because there's a sunset in this. Okay. We do this all the time. Every session, we hear sunsets. We hear the pros, we hear the cons, and 9 times out of 10 or 19 times out of 20, if it's something that's working, like physicians or dentists or landscape architects, then we move on. This is the smallest little thing, colleagues, that we can do as a backstop if things go south. And I'd ask for your aye vote.
Seeing no further discussion, the question before us is the adoption of Amendment L190. A division has been requested.
Hey, Holbert, do you have Jerry? Do you have Jerry?
There we go.
I took the elevator today. Are you sure? Okay, I'll look again. Are you sure? Because you asked me.
Maybe they just put them up when I was doors.
If you see the
Just one report, we've been ready for a while. When we took a break from the back and those here were not there.
She's watching me. Loving them with that body. Those are getting back to normal. It's pretty. It's weird how, like the last week or two, a lot of things have gotten back to normal. It's like I already forget, like the weirdness of the
Adoption of Amendment L190. A division has been requested. All those in the chamber not entitled to vote, please be seated. All those in favor of L190, please stand and remain standing until the count is taken. Please be seated, or put your hand down, or continue driving. All those opposed to the adoption of L190, please stand and remain in one place until the count is taken.
I do. That's why I'm sitting. Let's get rid of all sunsets. Sunset. No more sunsets. They're so intrusive. They're so scary. You might not have doctors.
Amendment L190 is lost.
So close.
Further discussion on House Bill 1232.
It's yours.
You want to discuss? While I get my. Run them.
There is an amendment on the desk. Mr. Panetta, will you please read Amendment L173?
Amendment L173 to House Bill 1232 by Senator Donovan. Amending gross
Senator
bill.
Donovan.
Thank you, Mr. Chair. Colleagues, this will be perhaps and hopefully the final big move on the bill. I think you've heard a theme from actually my colleagues who are opposed to this bill and my colleagues that are supportive of this bill, that one of the hallmarks of it has been constant compromise and trying to achieve meaningful healthcare reform for our constituents while making sure that the healthcare industry is at the table and we are setting things that can be achieved and executed so that we live up to our promise. And in order for things to be achieved and executed and lived up to our promise of lower healthcare and consumer choice, is that we think that hearing from the broad healthcare industry that it is appropriate to move the savings from 18 over 3 years to 15% over 3 years. And I ask for your aye vote on L173.
Senator Donovan, will you please move Amendment L?
I will not. Okay. Thank you, Mr. Chair, for keeping us on track. I move L173.
Further discussion on L173. Senator Smallwood.
Thank you, Mr. Chair. I would also move Amendment 173. Like all the prior amendments that we just heard, this is a good amendment, and I would ask for your aye vote on Amendment 173.
All 172 were good. All 172.
Senator Fields.
Thank you, Mr. Chair, and I also rise in strong support of this Amendment 173. I think once again it moves the bill in the right direction, and so I would urge an aye vote on this Amendment 173.
Further discussion? Seeing none, the question before us is the adoption of Amendment L173. All those in favor say aye. Opposed, no? The ayes have it, and the amendment is adopted. Is there further discussion? Seeing none, the question before us is the Senator Smallwood.
This is not to the amendment, it's to the bill. Mr. Chair, right?
further discussion.
That was quite accelerated, Mr. Chair. Wasn't quite anticipating that. So, colleagues, it's no secret if you've served in the Health and Human Services Committee and you've heard conversations about this that it's not a House Bill 1232 is not a bill that I can support just in principle. It's not a policy decision that I agree with. I think it takes us down the wrong road when so much has already been done in our state. I appreciate very much where the sponsors are coming from, where the proponents are coming from. Again, the technical flaws weren't really addressed today that I was hoping that they would. But the policy disagreement is always going to be the policy disagreement. And my prediction to you is that I will be standing right here 12 to 24 months from now talking about some omnibus health insurance bill because we need to do whatever we can to lower the cost of health insurance in our state for our consumers. We didn't do it with Connect for Health. We didn't do it with the reinsurance bill. We didn't do it with the health insurance affordability enterprise. We didn't do it with last year's public option bill. And colleagues, this bill, when passed, when implemented, is not going to lower costs. It is not going to give the proponents the better benefits that they've been promised. It's not going to provide more health equity in any way because none of us have heard how that can even happen. None of us have even heard an idea of how that can happen. And it's not going to provide more access. It's not going to do any of those, which is why we're going to be back here 12 to 24 months from now hearing something that moves us farther down the road towards the multi-state single-payer system that we were promised by our governor while campaigning. Until we get to that point, we are going to continue to see more and more bills. Again, I want to thank the sponsors for being open to conversations with me about it. I would strongly encourage a no vote on House Bill 1232, but do appreciate that some things were made better. Thank you, Mr. Chair.
Senator Janal.
Thank you, Mr. Chair. I just wanted to make a few comments about this bill, 1232, because, you know, I'm getting a lot of email like everybody else about, you know, you campaigned for reducing health care, and I'm getting a lot of emails that are in opposition to this bill, probably even more than in support. It's interesting that most of the emails come from Snowmass Village, Boulder, Grand Junction, Vail, other places that are in support of this bill. But one of the things that I find interesting in regards to this support is what the constituents have been told, by whom I'm not sure. But for example, I get this, and this is a form, and you all probably got it, but it says this bill is a huge win for all Coloradans. The Colorado option directly benefits families and small businesses by reducing premiums by 18%. That equates with roughly $1,000 back in the pockets of patients on a $500 monthly premium, which doesn't include the savings from lower out-of-pocket costs. For those who have been priced out of the health insurance market, this proposal could benefit more than 18,000 Coloradans, which it is a little bit higher than that, so you got that wrong, who are previously unenrolled in insurance. If this is successful or not, it could help more people than 18,000. But it concerns me that there's no way to check and see if this is working or not without a sunset, without who's watching over the Division of Insurance and the commissioner, how to improve what we're doing right now in the future as well. It may not give people what they're expecting. They may think they're getting a good deal on a premium, but that may result in less visits, less tests, and not the quality that they're used to getting on the exchange or through a carrier or other ways. I mean, we've heard testimony that actually said, these constituents came to testify and said that they're looking at this as free health insurance. No copays, no cost premiums. Somebody is leading them down a road that is really not the truth. And if that is the truth, more power to everybody if that happens. But I wanted to mention that because I think when people start talking about public options, going to save money, save premiums, they believe it, but they don't read the bill. They don't look at the statutes. They don't look at what we've tried in the past and what hasn't worked. And if we have tried it, we've had to go back and correct a few things. So that's one of the concerns that I have. The other concern I wanted to mention is something about, we had talked about Washington State, and Washington State was the only state that actually passed an option bill. And I wanted to read something that's out of a journal on health care that says, the standardized plan, yes, it is necessary, the standardized plan designs are the same as the regular standardized plans detailed above, but the public option versions were expected to have lower premiums due in part to lower reimbursements for medical care. This has not turned out to be the case. However, with the public option, rates as much as 29% higher than other plan rates in 2021. So Washington State is seeing an increase from 15% to 29% in public options. Interesting. Trying to lower the premiums. Not happening. Most of you know that health care is a very important part of my life. I've been in health care most of my life. If it wasn't in industry, it was in academics. And it's something that's near and dear to me, and I believe that health care is, if you don't have health, you don't have anything. In fact, that was a quote from my mom a long time ago. And I've worked hard on legislation that deals with the savings for people in health care, on prescription drugs, on other types of insurance, health care in general, whether it's physical or whether it's mental health care. But I believe that, you know, this is a bill that is leading people, and I hope it works. I really do. I hope this option, and I don't want to call it a public option. I don't want to call it a public-private partnership because, and that's what some people are calling it, because it's not anymore. It's an option. But I read bills, especially contentious bills like this, very carefully. And I struggle with this bill, that this will lower costs for patients. I believe in quality, I believe in value, I believe in making this bill, which I do agree we need to do something, but this bill right now, in the state that it's in, is it really going to help people? Is it really going to lower the premiums? And without watching this and forcing physicians to participate in this option, which we got rid of that, but mandating healthcare professionals, mandating insurance companies, hospitals, I just think that, you know, this is an option that I hope I hope it has positive results. There's no other state in this country that mandates anything like this. And I've just said in some of these journals that I've read about the state of Washington that health premiums of the option are going up and not down. Even the other states that have tried to pass public option bill made it into a study because they found it was kind of like what we're doing. We find it's been changed, 4 times when it came from the House to the Senate, but even more when it was in the House. It's got a lot more work to do. So, like I said, I believe that we could utilize a really good Colorado public option, but I'm not sure if this bill is there yet. And this is really important to me, and that's why I'm up here. You don't see me up here on a regular basis. I usually am pretty quiet, and when I come up here, I usually say a few words, whether I'm in support or in opposition to a bill. But I want people to know that I care about health care, that this is the issue, this is the main issue, one of the main issues that I fight for my constituents, for the people of Colorado. And I just wanted folks to know that I'm sure it may pass. I hope that, that it does do what it needs to do, but I think it needs a lot more work before we can say it's a Colorado public option. Thanks.
Senator Kirkmeyer.
Thank you, Mr. Chair. We spent a lot of time discussing this bill in committee. We spent a lot of time discussing it here. Unfortunately, most of you didn't have the opportunity to hear what we heard in committee. So I'm just going to tell you what we heard in committee very briefly. Because again, this bill, even though they took the fine, you took the fine out that was voted on today to take out the fines for doctors, we still left in the part that says after hearing, the insurance commissioner can still mandate participation. And keep in mind, he'll need to pass rules on what a hearing looks like, and he'll be passing rules on how to implement his mandatory participation by healthcare providers, physicians, in this bill. We've heard a lot today about how we're trying to lower costs and increase access. Yet in committee, when asked, no one would guarantee that out-of-pocket costs for low-income folks wouldn't go up. No one would commit to or guarantee that premiums would not increase. No one would guarantee that there would be health equity. In fact, no one could even explain what health equity meant in committee. Here's what else that doctors, mostly doctors, said about this bill, and yes, hospitals. And I'm just going to run through the comments very quickly. The bill is moving us in the wrong direction. It's a legislative mess. Will significantly worsen racial inequity. It will stifle innovation. It targets the front-range hospitals who have the larger percentage of patients with the greater needs. They won't be able to expand uncompensated services. It exasperates workforce shortages. It will hurt patient access. It makes private practice less viable. You two are like those guys on the Muppet Show. Grumley, what were their names? You two are like them. I'm going to find out their names, and we're going to change these names down here. To the bill. Moves us away from an integrated system and promotes outdated fee-for-service. It drives volume, not affordability. Remember, the goal was trying to lower costs and increase access. The 18% in the bill is arbitrary. It's not based on any actuarials that showed it's attainable or reasonable. We heard that premiums have been reduced by 28% since 2018. There'll be a decrease in patient programs and services that folks take for granted. The other thing we heard all the way up until the last committee is that the Colorado Medical Society had been stonewalled. Premiums will be destabilized and coverage may be dropped in a move to get to a public option. And I think the very last thing that, and I said this earlier, but I'm going to just say it again, because the physicians were very clear in this, and in looking at it, it's accurate. Because remember, there's still a mandate for physicians in this bill. Neither Medicaid, Medicare, nor any commercial health plan anywhere in the U.S. mandates physician participation. We heard the stories about how bad it is in certain areas of our state with regard to folks being able to pay for their premiums or their plans, what was going on. So I looked it up. Routt and Eagle County, there are 10 silver plans on the exchange. The cost is $409.57. That's a decline of over 30% in cost since 2019. That cost represents 12.9% lower than the national median for all counties. It is in the 22% of 3,100 in U.S. counties on price for lowest cost of a silver plan. You know, I asked in committee, what are we trying to fix? Never really got an answer other than we're trying to lower costs and increase access. Apparently, you know, I heard this morning as well that folks are choosing, you two. It looks just like you two. Waldorf and Statler. Thank you. Thank you, too, for lightening the mood. This morning, we heard that people are choosing between either paying their mortgage or health care or sending their kids to college. Apparently, everybody didn't get the memo. There was a memo that was released on April 21st, 2021 from the Department of Regulatory Affairs, Commissioner on Insurance, talks about how the enrollment is extended to August 15th. Anyone needs coverage for themselves or their families, now's the time to get enrolled. With the changes, because of the more financial assistance coming from the American Rescue Plan, with these changes, many Coloradoans could be looking at very inexpensive coverage, even with zero premiums. And this is what it says in the memo. 1 out of 5, 21% of customers could potentially have a zero premium if they were to stay with their current plan. 2 out of 3, 64% of the customers could potentially have a zero premium if they were to enroll in the lowest cost plan available to them. 3 out of 4 people could potentially have a $25 premium or less if they were to enroll in the lowest cost plan available to them. People who were making too much money before may now qualify for financial help to reduce premiums. So I just renew my question. What is it that we're trying to fix? I heard it's to lower the costs. I don't know how much lower you can get than zero premiums. I'm a no vote on the bill.
Senator Lundeen.
I know it's a shocker. Shocker. And I'm sure Statler and Waldorf.
Statler and Waldorf. Thank you, Mr. Chair. Fair enough. I rise in opposition to 1232 as well. This bill is a big stride, I believe, in the wrong direction for providing what the ostensible goal is, which is higher quality, more accessible, lower cost health care to the people of Colorado. It's an economic reality, the way these things unfold. When you begin to produce government mandates that tell a physician you must do this within this state, even though we've taken the fine away, physicians will find this state ultimately less attractive in which to practice. When you tell hospitals you must be capitated at this level of price, they will stop deploying capital into this state and choose to deploy it in other states that are more hospitable. than the state of Colorado chooses to become. Ultimately, it's the patients who lose out. It's us. It's our children and their children. It's the folks who are seeking access to high quality, lower cost care. This bill moves us in the wrong direction. And I want to finish my comments by hitting the pause button on this debate about this specific bill and praising the industry that was the first responder to the health crisis we've just come through. Was it government dollars that were the first dollars spent in taking care of the people of Colorado and America and around the world when in fact the pandemic struck? No. It was the accumulated profit, the capital that the hospitals had accumulated, that was deployed in the defense of the health of the people of Colorado and America. When we take away the incentive to succeed and say, government's going to control it, you'll be able to get by, it may not be comfortable, but you will survive, we become less attractive as a society, and our lives are all diminished. I want to be clear that we should, in this moment, pause and say, absent government mandate, present the capital reserves of the hospitals of Colorado, and present the sweat and concern of physicians and nurses and others in the healthcare complex, that we were served well by people, not by government, but by people who came to our aid when the pandemic struck. I think 1232 seeks to do something that's noble, but quite frankly, defying gravity, humans flying other than in helicopters and airplanes, isn't something that happens. This bill seeks to contravene the laws of economics. At the end of the day, it's a large stride on a path that I believe will give us more scarce access to health care, lower quality health care, and at the end of the day will cause a hockey stick price curve that will be difficult to manage as well. Thank you, Mr. Chair. Opposition to 1232 is, I think, the right place to be, and I encourage you all to find your way there, or at least think carefully about the vote.
Seeing no further discussion, the question before us is the adoption of House Bill 1232. All those in favor say aye. Aye. Opposed, no? No. The ayes have it, and the bill is adopted. Mr. Majority Leader.
Thank you, Mr. Chair. I move the committee rise and report.
The motion is for the committee to rise and report. All those in favor say aye. Opposed, no? The ayes have it, and the committee will rise and report.
The Senate will come to order. Senator Moreno.
Thank you, Mr. President. The committee has met and had a number of bills under consideration. Mr. Panetta, will you please read the report?
Mr. President, your committee of the whole begs leave to report out in consideration of the following tax bills being the second reading thereof makes the following recommendations thereon. House Bill 190, Senate Bill 190 is amended. Pass the second reading, ordering gross and place in the calendar for third reading, final passage. House Bills 1027, 1232 as amended. Pass on second reading, nor revised and placed in the calendar for third reading, final passage. Senate Bill 200 laid over until May 26, retained and placed in the calendar.
Senator Moreno.
Thank you, Mr. President. I move for the adoption of the report.
Motion is for the adoption of the committee of the whole report. There is an amendment at the desk. Will the clerk please read Amendment 001 to the committee of the whole?
Counter Amendment 001 to Committee of the Whole. Senator Kirkmeyer moved to amend.
Senator Kirkmeyer.
Thank you, Mr. President. President. It's president, nothing else. Not excellency, not anything else, just president. Okay, and thank you for that. Good senator from the balcony. All right, I move Cal Amendment 001.
To the amendment.
Thank you, Mr. President. 001, just because I think maybe you all were not really quite paying attention. 001 basically says that L180 did pass, and just to remind you of what that was, it would remove, I thought about doing the procurement one, but this one would remove the section that does the, not the fines, but removes the part that says hospitals may have their license suspended, revoked, or impose conditions on the hospital license, and it removes any penalties. So, ask for an aye vote, please.
Will the clerk please add Sarah Sonnenberg to the roll call? Is there further discussion? Seeing none, the motion is the adoption of Amendment 001 to the committee of the whole. Are there any no votes? Senators. Bridges, Moreno, Story, Gonzalez, Winter, Hawkins Lewis, Coleman, Colker, Danielson, Majority Leader, Hanson, Donovan, Lee, Buckner, Pedersen. Please add the President. Please add Senator Fields. Rodriguez. With 17 aye votes, 18 no votes, 0 absent, and 0 excused, Amendment 001 is lost. There's an amendment at the desk. Will the clerk please read Amendment 011 to the... Will you please read Amendment 001 to 1027?
Cal Amendment 001 to Senate Bill 1027.
Senator Cook.
Thank you, Mr. President. I move Cal Amendment 001 to 1027. I'll tell you. This says that the L016 to House Bill 1027 did pass, and this was the President's amendment.
No, this was Chris's amendment. No.
This was the President's amendment that says grocery stores and restaurants have to abide by the same hours that liquor stores do for delivery. So I would ask for an aye vote. It's about having equal level playing field for liquor stores. So I'd ask for an aye vote.
Is there any discussion regarding Amendment 001? Senator Bridges.
Thank you, Mr. President. So here's one of the main reasons we don't want to change this. One of the great things that to-go alcohol allows is when that last call bell rings, folks don't have to do a shot or 2 shots before they get in their car and drive home. I think it's better if they're not doing that, because instead they can get a drink that they can take with them to the next place that they go. And having something that they can, having something at the next spot is much better than consuming it right before you hop into a vehicle. Would ask for a no vote on this. And my co-prime, you have any more to add?
Having no further discussion, the motion before the body is the adoption of Amendment 001. Are there any no votes? Senators Story, Moreno, Priola, Bridges, Buckner, Fields, Danielson, Lee, Winter, Coleman, Huckus Lewis, Donovan. With 23 ayes, 12 no votes, 0 absent, and 0 excused, Amendment 001 is adopted. There's an amendment at the desk. Will you please read Amendment 002?
Amendment 002, Cal Amendment 2, Senate Bill 1027, or House Bill 1027. Senator Holbert moved to amend the report of the committee of the whole to show that the following Garcia Flora amendment to House
Minority
Bill-
Leader.
Thank you, Mr. President. I move Cal Amendment 2 to House Bill 1027, and I'm grateful for the reader reading through the portion of the name that follows the word following, because that name is the name of the president. He ran the amendment to 1027 earlier that just passed, and I'm grateful for your support, those of you who voted yes for that amendment, because we all want to be here in support of the president. This amendment would make another good change to House Bill 1027, and I explained this earlier, but in case you weren't here or you weren't listening, the past year of COVID has changed policy relative to liquor law. And through the governor's executive orders and legislation passed by the General Assembly, we have allowed restaurants to sell to-go liquor. Before COVID, the liquor stores would have put up a fight. We've seen those fights, the beer wars. But COVID changed things. Yep, COVID changed things. What I'm asking in this amendment, sharing this perspective with our president, is to change 2016 to 2026 to 2023. That's when this would sunset. So if we don't change this, this to-go scenario would be in statute for the next 5 years. We're coming out of COVID. I'm not prepared to say let's not help restaurants. I'm willing to say let's continue to help restaurants. But as we move out of COVID, how long do you want this to remain? Because if we went back a year before COVID, I said earlier, and I still believe, this bill wouldn't have made it out of the first committee. It would not. And if we go back to conditions that are pre-COVID, this law, if this bill were to pass, I think, should sunset sooner than later. COVID isn't going to have that kind of capacity restriction effect on restaurants for 5 years. If it does, we're going to be back into a similar scenario that we've been in the past year, and I don't want that at all. But if we don't have capacity restrictions, why would we move away from where we were before COVID, ask for an aye vote, and allow this bill to sunset in 2023 rather than 26? Thank you, Mr. President.
Senator Priola.
Thank you, Mr. President. Members, I asked for a no on this amendment, and let me tell you why. The restaurant industry has been brought to its knees the last 12 to 14 months. Many of the places we enjoyed spending time with friends and family will not be back. 5 years is not too long to help them get back on their feet, recover from the fact that they lost money for 14 months, had to get new employees, or had to lay employees off, and when they went to rehire, many of them never came back. The public also really likes this. Many things that came out of this pandemic will probably stick with us in the future, such as Zoom and Pelotons and so on and so forth. There is nothing wrong with this policy. We've seen that it's worked. The sky hasn't fallen. And I know there are some more than others that really admire the liquor store folks down here, and they have made record profits while folks have been locked in their homes, putting on extra weight, trying to keep it off on their Peloton. I asked for a no vote on this amendment. The bill, again, came out of the House 61-0 with 4 excused. Again, ask for a no on the amendment.
Is there further discussion? Senator Liston.
Thank you, Mr. President. Mr. President, I rise in support of L002. The reason I do, I love the restaurant industry. I'm a huge supporter of the restaurant industry. I love going out to eat just like the rest of us. But quite frankly, that industry, as well as virtually all the other industries here in Colorado, is rebounding like a skyrocket, like a rocket ship. Things are rebounding rapidly. If you go to a restaurant today, you can hardly get in. You can hardly get in. And to have this extend another 5 years, I don't think is needed. I think we'll see a full recovery here over the next year, 18 months, but this gives them 2 years. That is ample time for any industry. But I say that with the caveat that I love the restaurant industry. I support it. I want to encourage everybody to go out and eat this weekend and have your favorite beverage, as I know you will. But I think that Mr. President came up with a great amendment this morning, and for some reason I can't fathom it didn't pass. But the good minority leader has come up with a great cow. I urge an aye vote on this amendment.
Senator Bridges.
Thank you, Mr. President. I haven't heard the other side of the aisle say this many nice things about the president, I think, at all this session. And I just want to say I am so proud to be bringing both sides of this chamber together in this bill and on these amendments. I would ask, however, for a no vote. We have heard from restaurants that they are going to need 5 years at least to recover from the damage that was done during COVID. A decimation is if you lose a tenth of your forces. Colorado restaurants and taverns have been more than decimated this past year. We need to give them the time to recover, and I ask for a no on this amendment.
Senator Smallwood, followed by Senator Gardner.
Thank you, Mr. President. So, colleagues, I would just hope somebody could come up and tell me why we're talking about sunsets at all. We just heard vigorous debate about how horrible and scary sunsets are. So would love to hear something from the bill sponsors as to why we should even be considering sunsets on anything. Thank you.
Senator Gardner.
So, gracias, jefe. Mr. President. Members, I hope that the good senator from El Paso County doesn't love me as much as he loves the restaurant industry, or I might be sunsetted in a matter of a couple of years. The fact of the matter is, what we found, this is not a question of, well, we did this for COVID and we have to stop now, or we have to do this recovery thing. There are things that happened during the pandemic that we would have never perhaps tried. And some of them we found to be quite successful and not particularly harmful. I'll tell you, I would have voted against to-go alcohol prior to the pandemic simply because it's sort of like, I mean, you can get a margarita to go, and it'd be like my home state of Texas, where they used to have drive-through liquor barns, and you could just drive through and get a to-go drink and hit the road. But that's not what we had here. And the fact of the matter is, it's not been a huge public safety problem at all. It's been fine. It doesn't, there will be disagreement about this, but it does not cut into the market niche for packaged liquor stores. That's not where I'm going to buy a mixed drink. I'd make it at home, but I don't want the trouble. I want to be able to buy a margarita with my combo number 3 to take out indefinitely. And Mr. President, I don't want to be fined for threatening anyone from the podium here, from the well, but I mean, the difference on this amendment is whether I come down here and have to talk about this whole subject again with the good senator from El Paso County in 2022, or whether we can extend this to 2026 when I'm gone and he'll be here, and you'll have to listen to how much he might love the restaurant industry. I urge a no vote on this, and I urge a no vote, but I don't want to ever have to discuss it again in my time in the General Assembly.
Is there further discussion? Seeing none, the motion before the body is the adoption of Amendment 002. Are there any no votes? Senators Gardner, Moreno, Hawkins Lewis, Sonnenberg, Coleman, Priola, Bridges, Donovan, Story, Danielson, Winter, Buckner, Zenzinger, Patterson, Smallwood. Kirkmeyer, Lee. With 18 aye votes, 17 no votes, 0 absent, and 0 excused, Amendment 002 is adopted. There's an amendment at the desk. Will the clerk please read Amendment 002?
Now Amendment 002 to
Senator Kirkmeyer.
House Bill 1232.
Thank you, Mr. President. I move 002 to House Bill 21-1232.
To the amendment, Senator.
Thank you, Mr. President. This just simply says that the following floor amendment, 159 to 1232, did pass. This is the one that said the hospital with a case mix index that exceeds the statewide average must receive up to 10% point increase, and a hospital that delivers high-quality care, as determined either by score of 4 or higher according to the systems, would also get a 10%, up to a 10% point increase. Ask for an aye vote, please.
Further discussion. Senator Donovan.
Thank you, Mr. President. We passed an amendment that says that we will look at this exact thing, have that report back before we start the implementation of it, and look at how we can take into quality and acuity when we begin to sculpt the standardized plan and the reimbursement rates. So I feel that this amendment is unnecessary, and ask for your no vote on cow number 2.
Is there further discussion? Seeing none, the motion is the adoption of Amendment 002 to 1232. Are there any no votes? Senators Hawkins Lewis, Hansen, Moreno, Danielson, Coleman, Rodriguez, Kolker. Members, if This is, let's start again, members, please. On Amendment 002, no votes for 1232. Senators. Hanson. Donovan. Danielson. Coleman. Hawkins Lewis. Moreno. Story. Colker. Buckner. Winter. Gonzalez. Pedersen. Rodriguez. Bridges. Lee. Fields. Majority Leader. Please add the President. With 17 ayes, 18 no votes, 0 absent, and 0 excused, Amendment 002 is lost. There is an amendment at the desk. Will the clerk please read Amendment 003 to 1027?
Cal Amendment 003 to House Bill 1027. By
Senator Hanson.
Senator Hanson.
Thank you very much, Mr. President. I move Cal 003.
To the amendment, Senator.
Thank you, Mr. President. Members, I would like to ask for your consideration of Cal 003. This amendment creates an option for restaurants. If you read the amendment carefully, it says a restaurant may allow a customer to bring on and consume on licensed premises a bottle of wine. And if the restaurant decides to do that, they then can decide what charge they would like to levy for that service. Totally optional whether or not they want to do it, totally optional if they do what charge they want to levy for the corkage fee. I think this is a great option for the consumers of the state of Colorado. This is being done safely, responsibly in 45 other states. It has not had negative consequences on restaurants. It has been a great pro-consumer move. And that's what I would like to allow tonight with this amendment. Create the option for a restaurant that wants to do it. Create the option for those restaurants to charge a fee to offer the service. Totally optional. A great amendment for the consumers of Colorado.
Senator Priolo.
Thank you, Mr. President. Members, I rise in opposition to this amendment primarily for the fact that it doesn't fit under the title. The chair ruled this doesn't fit under the title. I don't want to even argue about the merits of the amendment, but this bill was narrowly crafted to achieve what the consumers have enjoyed the last 14 months and what the restaurants desperately need to stay afloat and still be around in the coming years. So ask for a no vote.
Senator Bridges.
Thank you, Mr. President. We had a title ruling during the Committee of the Whole on this, and it was determined that because the bill is about beverages for consumption off the licensed premise, and this amendment is for consumption of beverages on the licensed premise that are brought from off the licensed premise, that this did not fit under the title, so I'd request a title ruling on this, Cal.
Didn't see that coming.
The Senate will stand in a brief recess for a title ruling. The Senate will come back to order. The President has ruled that Amendment 003 does not fit under the title.
What are we doing? What was it? You ruled that it didn't fit under the title?
Yes. It's the title. Yeah.
There's an amendment at the desk. Will the clerk please read? Amendment 003.
Cal Amendment 003 to House Bill 1232 to the Committee of the Whole.
Senator Gardner.
Thank you, Mr. President. I move Committee of the Whole Amendment 3 to 1232.
To the amendment, Senator.
Thank you. Members, you're probably saying, well, what does this cow do? It says Senator Gardner moved to amend the report of the Committee of the Whole to show the following Gardner floor amendment, L 188 to HB 1232 did pass. Now, we've had a lot of good times this evening, and the hour is late, so cast your mind back to this discussion. I took you through the committee report and the amendment to the committee report to demonstrate to you that the problem with 1232 amendments was that we removed the warning and the fine for healthcare providers, that is physicians, who didn't participate in the plan, but we left the requirement and we left the power of the commissioner to require them to take those patients and to participate as a provider in that plan. And then I told you, you know, they're worse off once you take the warning and the fine out, because now you leave physicians who don't want to participate in the plan with an adverse ruling by the Commissioner of Insurance, and the Commissioner having the ability to go to the district court and say to them, you must do this, and you will do this, and if you don't do this, you're in contempt of court, and you'll be fined and jailed. And if you think that I'm being hyperbolic, I'm really not. I mean, I don't think anybody would end up in the jailhouse about that. But I do think that by leaving this requirement in the bill, the doctors have this false sense of security, because they say, well, there's not a fine anymore. Well, it's worse. Now, I understand from some in our body that when the amendment was first offered, that there were others here who said, oh, no, this, L188 is redundant. You don't need to do that. It's already taken care of. Well, no, it's not. No, it's not. I'm not in the habit of doing things that are redundant. Yes, he just said that.
Did he just say that?
I really am not. I may say things twice or three times till someone hears, but I am not in the habit of doing things legislatively that are redundant. We need to remove this requirement on the physicians so that they can practice freely in Colorado. And in fact, there are all sorts of due process and constitutional requirements. I urge your aye vote on Cal Amendment 003 to 1232.
Senator Lundin.
Mr. President, thank you. The hour is late, and we do at times get somewhat giddy, but having the capacity for the physicians of Colorado to practice freely of critical importance, I urge your support of the Gardner-Cow Amendment.
Senator Smallwood.
Thank you, Mr. President. I too rise in support of Cal Amendment 3. So, colleagues, this is not a major change to what has already been done with this bill. The proponents already agreed that penalizing physicians in our state monetarily was a bad idea. And mercifully, that part was removed from the bill. So since we've agreed that, at least in theory, that a financial penalty is bad for our physicians, why do we still want to make this act against the law? Why do we want to make our doctors and other healthcare providers lawbreakers, whether or not there's a penalty attached to it? There's the legal reason that you heard from the senator from El Paso County, which I completely agree with. But colleagues, just on principle, do we really want to tell our doctors, our nurses, our optometrists, our athletic trainers that they need to do this or they're breaking the law in our state? This is striking one very small piece of this bill. It is a great gesture, especially in light of what we just went through with a global pandemic and a subsequent recession, to tell our healthcare providers that we're not out to make them lawbreakers. We encourage them to participate, but we're not going to try to hold them accountable for this. I really encourage an aye vote on Amendment 3. Thank you, Mr. President.
Is there further discussion? Seeing none, the motion, Senator Donovan.
I ask for a no vote on Cow 003.
Having no further discussion, the motion is the adoption of Amendment 003. Are there any no votes? Senators Hawkes Lewis, Gonzalez, Moreno, Story, Danielson, Coleman, Lee, Pedersen, Winter, Buckner, the Majority Leader, Hansen, Rodriguez, Colker, Fields, Donovan, Bridges. Please add the President. With 17 aye votes, 18 no votes, 0 absent, and 0 excused, Amendment 003 is lost. There's an amendment at the desk. Will the clerk please read Amendment 004 to 1232?
Amendment 004 to 1232. Senator Smallwood moved to amend the report of the committee holder so the following Smallwood Amendment L166 to House Bill 21-1232 did pass.
Senator Smallwood.
Thank you, Mr. President. Colleagues, I'm so glad everyone's back in the chamber to be able to hear this, as we, I think, mistakenly did not pass.
Senator, will you please move the amendment?
166. I move, Mr. President, I move Cow Amendment 4.
To the amendment, Senator.
Thank you, sir. Amendment 166, as you'll recall, was what I promised everybody to get a chance to take another look at. And I'm assuming that perhaps it wasn't explained well. The way Amendment 166 reads is that if a health plan has already negotiated a lower rate than what this new healthcare rate lowering bill proposes, that the lowest rate is what prevails. So, colleagues, we're hearing a bill that is going to allegedly lower health insurance costs. It's going to lower healthcare costs. And there are health plans today that have negotiated lower rates than what the bill proposes. Amendment 166 simply says, if that negotiation has already happened, the carrier has already negotiated lower rates than what the bill is proposing, that we want to keep the lower rates so our constituents pay less for health care and therefore less for health insurance. Lower, better than greater. Amendment 166 encourages the lower pre-negotiated rates from the carrier. Part of me, in a really strange way, hopes that you don't vote yes on this because it'll give me something to talk about for the next 12 months. Would ask for an aye vote for Cow Amendment 4.
Is there further discussion? Senator Donovan.
As for a no vote on Cow Amendment 4.
Having no further discussion, the motion is the adoption of Amendment 004. Are there any no votes? Senators Coleman, Moreno, Hansen, Gonzalez, Hawkes Lewis, Story, Danielson, Pedersen, Janal, Winter, Lee, Buckner, Bridges, Colker, the Majority Leader, Fields, Donovan. Please add the President. With 17 aye, 18 no votes, 0 absent, and 0 excused, Amendment 004 is lost. There is an amendment at the desk. Will the clerk please read Amendment 007 to 1232?
Count Amendment 007 to 1232. Senator Smallwood moved to amend the report of the committee of the whole to show the following Smallwood Amendment L.
Senator Smallwood.
Thank you, Mr. President. I move Cal Amendment 7.
To the amendment, Senator.
007, Mr. President. 007. We talked a lot about sunsets today. 10 years from now, when none of you are here, but hopefully all doing well, if for some reason the standardized plan did not materialize the way that the proponents hoped, then this would be sunset, very much like how we sunset lots and lots of other things in our state. Ask for an aye vote on Amendment 7.
Is there further discussion? Senator Donovan.
I ask for a no vote on L007. We should not repeal an insurance product that would become part of someone's life. I ask for a no vote on L007.
Having no further discussion, the motion is the adoption of Amendment 007 to 1232. Are there any no votes? Senators Coleman, Gonzalez, Hawkes Lewis, Buckner, Winter, Pedersen, Story, Colker, Moreno, Rodriguez, Hansen, Lee, the Majority Leader, Fields, Danielson, Donovan, Bridges. Please add the President. With 17 aye votes, 18 no votes, 0 absent, 0 excused, Amendment 007 is lost. There is an amendment at the desk. Will the clerk please read Amendment 008 to the Committee of the Whole, 1232?
Count Amendment 008
Senator Rankin.
1232.
Thank you, Mr. President. This amendment simply reverses the vote on Amendment 189. If you recall on...
Senator, will you please move the amendment?
I move Amendment 189.
To the amendment, Senator.
If you recall this discussion, this has to do with achieving the 18% goal, reduction goal, and really the starting point. We do not give credit for efforts that are underway or have been achieved. And this simply says that if an organization, whether it be a cooperative, an alliance, or a locally organized organization, has been active and has reduced healthcare cost, working with an insurance carrier so that you can demonstrate that there has been a reduction, then that entity, that county, and that carrier get credit for that reduction. So they're starting from that point to reach the 18% reduction. I gave a couple of examples. I think the most glaring is the Valley Health Alliance, which covers the Roaring Fork Valley from Aspen to Glenwood. And in 11, they've been at it for a number of years. They organized a nonprofit organization, and they set up subcommittees, worked very hard on specific services to reduce health care costs. Their carrier is Rocky Mountain Healthcare, who came into the market. They can show specific reductions, somewhere between 5 and 15% to be verified, and they are now being asked to start over to show an 18% reduction. So this merely says that they get credit for the work they're already doing, and we encourage that. The other example I had was actually Peak Alliance, which is covered in the bill and does get exception if they have already achieved the 18%. They don't get credit in their home county of Summit County, where they've achieved a 9% reduction already. They should have a different starting point. So they go from the 9 they've already achieved to 18. It just makes sense that we encourage those efforts that have already been underway. So I encourage a yes vote on Cal Amendment number 8 to 1232.
Senator Donovan.
Thank you, Mr. President. As for no vote on Cal 008, it actually won't achieve the goals that might be signaled as the committee sponsors goals, but will have impacts on the overall ability for us to offer lower health care to our constituents. Thank you, Mr. President.
Having no further discussion, the motion before the body is the adoption of Amendment 008 to the committee of the whole on 1232. Are there any no votes? Senators Coleman, Hansen, Moreno, Gonzalez, Janal, Winter, Story, Danielson, Zenzinger, Hawkes Lewis, Lee, Buckner, Rodriguez, Kolker, Pedersen, Fields, the Majority Leader, Bridges, Donovan. Please add the President. With 15 aye votes, 20 no votes, 0 absent, 0 excused, Amendment 008 is lost. The motion is the option of the committee of the whole report. Are there any no votes? With a vote of 35 ayes, 0 no, 0 absent, 0 excused, the committee of the whole report is adopted. Senate Bill 190 as amended passed on second reading, ordered and grossly placed on the calendar for third reading and final passage. House Bill 1027 as amended, House Bill 1232 as amended, passed on second reading, ordered and revised, placed on the calendar for third reading and final passage. Senate Bill 200 laid over into 52621, retaining its place on the calendar. Committee reports.
May 25th, Committee on Health and Human Services, after consideration of the merits, committee recommends the following. House Bill 1198 be amended as follows. So amended be referred to Committee on Appropriations, favorable recommendation. May 25th, Committee on Health and Human Services. After consideration of the merits, committee recommends the following. House Bill 1171 be referred favorably to Committee on Appropriations. May 25th, Committee on Health and Human Services. After consideration of the merits, the committee recommends the following. House Bill 1005 be referred favorably to Committee on Appropriations. May 25th, Committee on Health and Human Services. After consideration of the merits, the committee recommends the following. House Bill 1305 be amended as follows. And so amended be referred to the Committee of the Whole with favorable recommendation. Recommendation placed on the consent calendar.
Introduction of bills.
House Bill 1209 by Representatives Gonzalez, Gutierrez, and Doherty, and Senator Lee concerning offenders who committed an offense when under 21 years of age and in connection with making an appropriation.
State Veterans and Military Affairs.
House Bill 1275 by Representative Lantina and Will and Senators Janal and Kirkmeyer concerning reimbursement for pharmacist services under the Medical Assistance Act and in connection with making an appropriation.
State Veterans and Military Affairs.
Oh, gosh. House Bill 1311 by Representatives Sirota and Wiseman and Senators Hansen and Moreno concerning income tax and in connection therewith requiring additions to Colorado taxable income and amounts related to limited certain federal itemized deductions, extending the limit on the federal deduction allowed under Section 199A of the Internal Revenue Code, limiting the deduction for contributions made to 529 plans, disallowing an enhanced federal deduction for food and beverage expenses at restaurants, and limiting the capital gain subtraction, allowing a subtraction from Colorado taxable income and amounts related to repealing the cap on the deduction for certain Social Security income, reducing state income tax revenue by increasing the earned income tax credit, funding the child tax credit, and allowing a temporary income tax credit from our business equal to a percentage of the conversion cost to convert the business to a worker-owned co-op, an employee stock ownership plan, or an employee ownership trust, increasing state income tax revenue by modifying the computation of corporate income tax receipts factor to make it more congruent with combined reporting, preventing corporations from using tax shelters in foreign jurisdictions for the purpose of tax avoidance, clarifying that certain captive insurance companies are not exempt from income tax, and making an appropriation.
Finance.
House Bill 1314 by Representative Herod and Gray and Senators Moreno and Rodriguez concerning the authority of the Department of Revenue to take action against certain documents and in connection with making an appropriation.
Finance.
House Bill 1318 by Representatives Herod and Ortiz and Senators Garcia concerning the creation of the Outdoor Equity Grant Program and in connection with funding the grant program from lottery money and making an appropriation.
Finance. Signing bills.
May 25th, the President has signed Senate Bills 11 and 35.
Announcements. Senator Zenzinger.
Thank you, Mr. President. The Senate Education Committee will meet this evening. We will meet upon adjournment of the Senate Local Government Committee, but rather than meeting in House Committee 107, we will be meeting in the Senate Committee Room 352. We will be hearing House Bill 1294 and House Bill 1304.
Senator Janot.
Thank you, Mr. President. Senate Local Government Committee will meet in 352. We are going to hear the members of the State Board of Housing. There are 3 folks, as well as House Bill 1285, 1296, 1278, and 1284.
Senator Gonzalez.
Thank you, Mr. President. Colleagues, this serves as an important announcement regarding State Veterans and Military Affairs Committee because it reflects a change to the calendar, and we're also shuffling around the order of the bills. And so I do want to announce that we will be meeting, State Affairs will be meeting here 15 minutes upon adjournment, so 8:15 or thereabouts in the Old State Library, room 271. We will be hearing a number of bills, but we will be hearing them in a different order than they appear on the calendar. We will be hearing the bills in the following order: Senate Bill 280, House Bill 1250, House Bill 1280, House Bill 1281, House Bill 1299, House Bill 1255, House Bill 1298, and House Bill 1162. Colleagues, I'll see you in the Old State Library shortly.
Senator Winter.
Thank you, Mr. President. Transportation and Energy will be meeting 15 minutes upon adjournment. We will be hearing 4 bills. We are going to hear 272 first, then 1014, 1269, 1303, and a reminder that we will not be hearing 264 tonight. We will be doing that in a special Transportation and Energy Committee meeting tomorrow upon adjournment.
Senator Hansen.
Thank you very much, Mr. President. Members of Senate Appropriations Committee, we are going to be coming back together tomorrow morning at 8 o'clock in LSBB. I would like to share the bill list with you. House Bills 1012, 1068, 1069, 1071, 1085, 1094, 1150, 1194, 1195, 1228, 1238, 1273, Senate Bills 33, 62, 269, 271, 274, 275, 276, 277, 278, 281, 283, 286, and 287. See everybody bright and early. It's not ready.
Senator Donovan.
Thank you, Mr. President. Senate Ag and Natural Resources will meet in 15 minutes after adjournment to hear the appointees for the Great Outdoors Colorado Board. There will be a change in membership of that committee. The minority leader will be replacing Senator Sonnenberg. And I would like to add that Senator Sonnenberg wins for the best background of the session, but he loses for the most appropriately dressed farmer.
Senator Winter.
Thank you, Mr. President. Transportation and Energy, we are not meeting 15 minutes upon adjournment. We are meeting upon adjournment of the Agricultural Committee. So approximately 30 minutes.
Mr. Majority Leader.
Thank you, Mr. President. Hopefully everybody something in Andrew's throat.
Senator Hansen.
Thank you, Mr. President. We found one missing number. So for Senate appropriations, please add 273 to your list.
Mr. Majority Leader.
Thank you, Mr. President. Hopefully everyone knows what is happening and where to go. We have several committees this evening still. Have fun. I'll see you in some of those committees. We will keep the desk open for just a little bit to get at least the Senate bills, to get the reports read across so that we can act on those as soon as possible in the coming days. So, Mr. President, I do move that the Senate recess until 8:30 p.m. It's not part of the deal.
I was going to ask for personal privilege. We're going to talk about the senator from Hot Sulphur Springs.
Your candidate, 30. Who's that? Baumgartner?
You have heard the motion. All those in favor say aye. All those opposed, no. The ayes have it, and the motion is adopted, and the Senate will stand in recess until 20:30 tonight.